So welcome to another edition of our Society for Biomaterials Member of the Month. And today we have Rebecca Carrier, who will introduce herself.
Hi, my name is Rebecca Carrier, and I'm an Associate Professor of Chemical Engineering at Northeastern University. My research is broadly in the areas of drug delivery and regenerative medicine, and our focus in drug delivery is on oral drug delivery and the impact of lipids on oral compound absorption and mucosal barrier properties. Our focus in the regenerative medicine and tissue engineering field is on development of biomimetic biomaterials, and right now we're focusing on intestinal and retinal tissue engineering.
So Rebecca, what made you choose a career in biomaterials?
Well, I was studying chemical engineering at RPI, and I got into the field of chemical engineering because I was interested in chemistry and math, like a lot of people who end up studying chemical engineering. And while I really enjoyed the field of chemical engineering, I was most interested in the way that chemical engineering concepts could be applied to biological systems. And because of that interest, I ended up pursuing graduate studies in tissue engineering and really enjoyed those studies as well. But was looking as I neared the end of my graduate career to work on some problems and some applications that I thought might reach a patient population in the more near future, because while tissue engineering was very exciting, there were just so many barriers, especially at that time, to getting commercial products to patients. And for that reason, I ended up working for a few years in the pharmaceutical industry in drug delivery. And really the thing that kind of ties those two fields together, which I now both do research in both of those fields, is the interaction of biomaterials with biological systems. And for that reason, I basically do research now in the field of biomaterials.
So Rebecca, you have an interesting history where you've worked for both industry and now you're working for a university. I'm wondering if you could comment on why you chose to work for a university now as opposed to industry in biomaterials.
As I mentioned, part of the motivation for wanting to work in industry was to be able to work on products and projects which could have an impact on a patient population in the relatively near future, potentially relative to some of the projects which might be worked on in an academic setting. And that was really exciting. I was lucky in my industrial position in that I had a fair amount of freedom in the types of projects and problems I was addressing. But I knew as it needs to be in an industrial setting, was driven by the abilities of the company at that point in time and their particular needs, and that could change in the future. So I started looking at academic careers so that I would have freedom to work on the specific problems and projects that I found most interesting. And that was really why I made the transition.
So Rebecca, what do you like best about your job?
Well, as I already mentioned, one thing that I think is really great about working at a university in general is having complete freedom, really, to work on the types of questions and research problems that you think are most interesting, which is great. Another thing that I really enjoy is working with students and being able to share that excitement with them for research and excitement for the specific types of research that we do in biomaterials. One thing in particular I think is great about the field of biomaterials is that it is such an interdisciplinary field. So it's a lot of fun to be able to collaborate on research projects with people with different backgrounds.
So Rebecca, there's always downsides to every job. So I'm wondering what you like least about your job.
Nothing. No, I'm joking. The thing I definitely like least about my job is that there are so many sort of exciting questions to try to answer in our research, and so many fun aspects of our job as an academic in general, between research and teaching, that it seems like there's just not enough hours in the day to do all of the things that we want to do, because they really are all truly fun. And so sometimes it's just tough to have to make decisions about what you can do and can't do.
Rebecca, what advice do you have for students who want to have a career in biomaterials, whether it's in industry or at a university?
Well, I think, as I mentioned, one of the really neat things about the biomaterials field is that it's so multidisciplinary. So one thing I like to tell students is that regardless of what their background is, even if it's in a more traditional engineering field or a specific science and not specifically in biomaterials, that a lot of times those fundamentals that they're learning in their specific field can be applied very, very well to the biomaterials field. And not to be afraid to sort of make that bridge, even though they might be learning concepts in their class which are applied to more traditional systems, to try to make that bridge between those fundamental concepts and biomaterial systems.
So Rebecca, this is my favorite question of all, and it asks you to look into the future and tell us where you think biomaterials research is headed.
Well, I think there's a lot of potentially excellent answers to that question. One thing I think is particularly exciting is the fact that the field of biology has just undergone so many huge advances and really advanced to the area where it advanced to the point where we have sort of a molecular level understanding of biological processes and biological systems. And that's really enabled more of a quantitative specific understanding of how biological systems like cells respond to stimuli like those presented from biomaterials. So I think one of the things that's going to be most exciting moving forward in the field of biomaterials is when we observe the response of different biological systems to the materials that we're developing, that we'll be able to take a more quantitative approach to understanding why we're observing a specific response and understanding some of the signaling pathways and reactions going on within the cells which are resulting in the responses that we're observing.
Rebecca, thank you very much for your answers to our questions today. I think we really appreciate it, and I know that the students and other people will really appreciate your advice. Thank you.